Tobacco kills more than 6 million people annually across the world. More than 5 million of those deaths are the result of direct tobacco use, while more than 600,000 are caused by non-smokers being exposed to second-hand smoke. Nearly 80% of the world's 1 billion smokers live in low and middle-income countries, according to the World Health Organization. Smoking also causes a number of cancers, heart disease, and other serious ailments.
People know about cancer, and they know cancer is a killer. Anyway, when you get it, it shortens your lifespan. In addition to that, tobacco causes many chest diseases, including chronic diseases of the lungs, which distort the lungs, making them difficult to perform their function of taking in oxygen and taking out carbon dioxide. We call them obstructive diseases arising from tobacco use. Even people who are prone to asthma, when they smell any whiff of tobacco, the asthma, which maybe was silent, will come up. Furthermore, tobacco affects the whole system, the blood system, what we call cardiovascular, from the blood vessels, which are damaged by tobacco, to the heart, leading to heart diseases.
In Uganda, the Uganda Tobacco Control Act 2015 came into force on May 19, 2016, 6 months after being gazetted on 18 November 2015. The Tobacco Control Bill was passed by Parliament on 28 July 2015 and was assented to by the President on 19 September 2015. The Act is a fulfillment of Uganda's obligations to the World Health Organization Framework Convention on Tobacco Control, which the country signed on 5 March 2004 and ratified on 20 June 2007. Some of the key regulations in the Act include prohibition of smoking in all public areas, workplaces, means of transport, and other outdoor space within 50 meters of a public place. The other restrictions include a total ban on advertising, promotion and sponsorship by tobacco manufacturers, distributors and sellers, including at points of sale, and the total ban of some tobacco products, including shisha. However, even after the Act was passed, there are a number of challenges in implementing the regulations.
This is a new law, which people didn't take seriously. And even for us, the enforcers, we have to educate those who are supposed to enforce the law. I have to be enabled to move, one, to roll out to the districts, to the regions, so that I teach the police, the staff, I equip them with the necessary knowledge to enforce this law. Two, shisha is banned. Cuba is banned. It should not be talked about anymore. It is banned. It's a banned commodity. And then the problem is, who is importing it and how are they importing it? What is URA doing about it?
We are looking at having police and NEMA throughout the country being able to say this is how we understand the law and this is how it is going to be implemented. I think that our view and our plan is that immediately we finish the implementing regulations, you must have, you see, the law is the big picture. It gives you a guideline. You must have regulations for people to follow in order to be able to say, this is the, when you break the law, this is going to be the punishment.
Many people are saying, the law is not being enforced. I did my part, me and my team. Our job is to give all the technical support to government to come up with a strong law, because Uganda is a party to the Framework Convention on Tobacco Control. What is remaining is enforcement. Unfortunately, there is a lot of misinformation from the tobacco industry, which tries to confuse the information we give, and also we need to educate, to sensitize and orient the enforcement officers.
Health experts say that although aware of the devastating consequences, the tobacco industry continues to target young people as it's more concerned with raking in profits.
Farmers need to know that apart from being cheated, because the tobacco industry has a monopoly, even the money they pay them is not worth their labor. And on top of that, they're also taking tobacco into their own skin. They absorb it. Their women get miscarriages. They get chest problems. Also at the risk of their children starting to smoke early because tobacco is just there in the garden in front of them. Then at the end of it, when the mathematics is done, it is we know that according to the labor they put in, actually at the end of the day they make a loss. And there are so many alternative crops.
Uganda is no exception to the subtle marketing strategy of the tobacco industry. Advertising and sale of tobacco products increasingly target children and youth. Among youth aged 13 to 15 years, 10.9% of ever smokers were initiated to smoking. 4.8% currently smoke cigarettes, and 15.6% currently use other tobacco products. According to a recent survey conducted by African Tobacco Control Alliance and Uganda National Health Consumers Organization, the findings portray a grim picture. There was revelation that many tobacco products are promoted and sold around schools in Kampala. The survey indicates that school children can buy tobacco products from points of sale around schools and convenience stores. According to the survey, the convenience stores were the most popular form of tobacco sale outlets, with a total of 15 around 10 of the 16 schools surveyed. In addition, there were 7 supermarkets selling tobacco around 5 of the 16 schools surveyed.
So you have schools where the tobacco industry has targeted the areas where school children are dropped. So many times school children wait. If you go to areas like Kampala parents, like others, there are open places where children will wait for parents, where parents will drop kids and then they can walk into the school, and you have big tobacco displays in the windows of the shops, you see that anybody who is, especially young people who spend a lot of time there, you have sweets displayed and balloons displayed next to the tobacco products.
Studies show that few people understand the specific health risks of tobacco use. Among smokers who are aware of the dangers of tobacco, most want to quit. Counseling and medication can more than double the chance that a smoker who tries to quit will succeed. Emmanuel Mutaiziwa, NTV Weekend Edition.